everyone, my name is Rebecca Warren, and I will be discussing clinical informatics and remote patient monitoring. Clinical informatics has been important in healthcare for assisting in clinical decision making, data collection, and documentation, to name a few. Ever since COVID-19, we have come so much further with electronic technology in healthcare. The ability to complete virtual visits to speak with a provider has truly helped at a time where the world was shut down, but people still needed to see doctors and get medications because they were sick. Clinical informatics and health information technology have transformed healthcare in so many ways. The growth has led to better healthcare delivery, improved health outcomes, and better patient engagement to support patient-centered care. Barker et al., 2024. The implementation of the 21st Century Cures Act helped introduce specific provisions to increase the exchange and availability of health information. This act emphasized the critical importance of systems working together and put in place different methods to combat information blocking, making sure that healthcare data could be exchanged and used more freely and effectively. Barker et al., 2024. Clinical informatics is the different ways that technology can impact clinical research, healthcare education, and patient data. The goal of clinical informatics is to provide relevant data and information to clinicians to enhance their clinical decision making, such that it leads to improved patient outcomes and reduces medical errors. Nadkarni and Sadpuja, 2023. Electronic health records allow for better collaboration and quality of care for patients, with providers being able to track previous care and results from different specialties all in one place. Clinical informatics offers the potential to improve patient care, lower healthcare costs, and improve the health of the population. This requires more than just knowing how to input data into an electronic health record for patients. The ability to be able to click a few buttons to have access to test results, scheduling, messaging a provider, or checking in for an appointment is amazing. It's also amazing to be able to have prescriptions electronically sent over from your provider to your pharmacy and being called when it's ready without having to go to the doctor's office, pick up the written prescription, drop it off at the pharmacy, and wait for it to be ready. Telemedicine was originally created to care for astronauts during space missions, and now it's being applied to patient care every day. Perm, 2023. Remote patient monitoring offers ways for healthcare practitioners to gather real-time information on the physical conditions of patients. Perm, 2023. The ability to perform virtual visits to check up on a patient through a computer or phone screen is part of this process. Patients can also have different medical equipment at their home that can be prescribed to patients, and the providers can walk the patients through how to use those devices, how to self-administer different medications, or to even check their vital signs. Remote monitoring can help cut costs, reduce space in the hospitals, and limit patient readmissions. It can gather information in real time, and providers can monitor any wearable devices as well. Some possible challenges of remote patient monitoring include possible increased provider workload, inaccuracy of data, privacy concerns, or even patients that are not very technologically savvy could experience some confusion or frustration. Healthcare would not be where it is today without clinical informatics. We have become so reliant on technology that it just continues to get better as time goes on. Research and experience in informatics comes with working out any fixes and always looking for improvement. Important advancements in clinical informatics has paved the way for a more efficient and safer healthcare environment. Thank you.